Yeah, no, I don't think everybody should be covered. I don't think they should get health insurance if they can't pay for it, unless the charitable institutions, they pay for it. It used to be in America that hospitals had charitable funds to pay for those people who did not have insurance, and that cost was not passed on. That cost, you know, you're going to speak over everything I say. That cost was not passed on then to taxpayers who have nothing to do with the accident that this person would get engaged.
Who pays it? The bill fairy?
There is a difference between voluntary charity and between forced taxation and redistribution of wealth to those who are irresponsible enough not to buy health insurance.
There are 3 fewer hospitals in my home borough of Queens, not because they don't want to offer the care. No, that's not true. Because of uninsured.
50% of all dollars spent on health care in the United States today are spent by government.
If you want,
we already have a government-run health care system.
Let the congressman speak.
Here's what I want you to do. I want you to show us the independent source that you have, not some congressman saying something that says that 2/3 of the uninsured people in this country don't want health care. Was it a public opinion survey? Was it a study by... Who said that? I'm really very curious.
What, are you so happy to have one little thing to grab on that
Listen, watching CNBC, I wish it was
Do you
one.
agree that health insurance should be mandatory and that families should be penalized if they don't get it?
And if somebody chooses to send their money elsewhere, the government is going to tell them, no, you need to buy insurance policy. You're a bad person for spending it on education or starting a business.
No, let me ask you something. If someone hits you with their car and they're uninsured, sure, they have to get a new fender and pay for it. But what if you're injured? The reason we have mandatory insurance in that case is because that other person's irresponsibility costs you money. It's the same with healthcare. I have 3 fewer hospitals in my home. Let me finish my thought. I have 3 fewer hospitals in my home borough of Queens because people come in uninsured. They pass along the bills to the federal, the state and governments. They pay a portion. And some of it they have to eat. That's what we're doing. We're providing cheaper capacity. That's what we're doing. Don't allow it. Then the bill fairer pays that too. We're trying to provide people with coverage the same way you have it, so they don't go into hospital emergency rooms and stand in front of you and your family when they should be getting checkups.
Okay, so a couple suggestions here, because I've followed healthcare for a long time, and I would say that the reason you lack 3 hospitals in your district is because they didn't do a good enough job of managing their costs and their expenses, and they weren't a well-run business.
They're required to cover the uninsured.
Nobody put them out of business. They put themselves out of business. Second of all,
you give me
when
one
you get in a
business
car,
that's required to provide the service.
I let you guys talk, and I know you're in Congress, but I really wish that I could get it in this point here. When you get in your car, you pose a risk to me, and that way the state forces you to have insurance.
No.
But me inside my body with my health, I'm not posing a risk to you.
What if you got hit by a car?
What do you do if you get hit by a car and you're uninsured?
And you have $60,000, $70,000.
You depend on the
if I have a heart attack, I am now posing a risk to you, and therefore, why should I be forced to buy insurance if I decide to
depend on charity? Just like if you don't have food and you can't eat, you depend on charity. You don't depend on redistribution of wealth and forcing people to help you out.
You get brought to my hospital. You get brought to my hospital that I pay taxes for.
So fix that. You have the ability to fix that.
No, the insurance has no choice.
By changing the law to prevent hospitals from being able to...
The hospital has no choice but to patch that person up, as it should be. If you got brought in there, they have to patch you up. It's just wrong what you're saying.
You know what? I think the most important thing to know from this debate is that it's awfully important to keep the channels open, to keep talking, and I appreciate the spirited debate, and I appreciate the congressmen for taking the time to come here and tell us their views and to express them so passionately.
So do we.
And I thank you, gentlemen, for coming on air, and I hope you'll come again.
We like that.
All right, thanks very much.
Good night.
Okay.